Hello and welcome to the Daily Aus. I'm Emma Gillespie.
I'm Billi FitzSimons.
The Victorian Government has released the final report from its landmark inquiry into women's pain. The findings paint a stark picture where thousands are suffering unnecessarily within a healthcare system that has failed to address chronic pain. Today, we are going to break down exactly what the inquiry found, what it's recommended, what happens next, and what it tells us about women's pain on a national scale.
I feel like over the past few years, maybe the past 5 or 10 years, I have really heard more and more people talking about women's pain in open places, in media, in reports.
Yeah.
What prompted this inquiry? Is it that people are now just talking about it more?
Yeah, you're absolutely right, Billi. There has been a shift in the national conversation. Obviously, we're talking about Victoria today, but there has certainly been a change in the way the media, educators, health institutes, governments, policymakers speak about women's pain. But we first heard about this inquiry back in January 2024, so nearly 2 years ago. And that announcement came with the release of new data. That data showed 40% of women across Victoria live with chronic pain, including pain associated with periods, pregnancy, and conditions like endometriosis. Around half of those surveyed said that pain associated with periods affected their health and well-being. 1 in 3 said they have a health condition like ongoing migraines, cramping, endo, and that affects their ability to work and keep a job. And a third of respondents reported feeling stressed and frustrated after receiving insensitive and disrespectful healthcare advice.
Okay, so that initial survey showed significant issues. What was the goal of this subsequent inquiry? Because they've established that there is an issue here.
Yeah, exactly.
What did the inquiry want to establish that was different?
Off the back of those findings, Health Minister Mary-Ann Thomas said an expert panel led by the Victorian Women's Health Advisory Council would examine what she called a systemic gender pain gap. Now, essentially, that means that the inquiry's focus was on women's experiences and how the state's healthcare system addresses pain caused by periods, pregnancy, and endometriosis. Victorian Premier Jacinta Allen did warn in advance that these findings probably wouldn't be a mic drop moment for a lot of women around the state, but she said it was, quote, time we stopped treating women's health like a niche issue. We deserve to have our pain believed and relieved.
Interesting. And so now we have this report.
Yeah.
What did it reveal?
Well, before we dig into the findings, I think it's important to flag that this report specifically notes that references to women and girls are, quote, intended to include anyone who may experience similar health issues or gender-based discrepancies in care. So this includes those assigned female at birth, anyone who identifies as a woman. That is the language in the report. So that is the language that we will use today, Billi. And in terms of how the inquiry defines pain, it's such a common part of women's lives, but there is a huge diversity of experience. And according to the report, references to pain include any experience of pain and pain care, treatment or service that women and girls have had over their lifetimes. So that could include pain from an injury or trauma, joint pain, musculoskeletal pain. It could also be related to reproductive pain, heart, neurological, autoimmune, a range of health conditions. Women were invited to make submissions to the inquiry, and that was an offer taken up by over 13,000 Victorians. And the final report released on Sunday shows 90% of respondents experienced pain that lasted over a year. So that's chronic, ongoing pain affecting their daily lives. 54% experience chronic pain daily. 31%, nearly a third of women, experience it constantly. 65% of respondents rated their pain intensity between 7 and 9 out of 10, 10 being the worst pain, and 89% said their pain impacts their mental health. Half said it impacts their energy levels, their overall fatigue.
And I feel like every time I hear this topic of conversation come up, a lot of women say that when they go to their doctor, they don't feel like their issues are necessarily taken seriously, or sometimes they feel gaslit by the healthcare system. Did the report say anything about women accessing the healthcare system?
Yeah, barriers barriers to accessing care were a major part of this report. They took up a big chunk of the findings, and there is that common experience, that sentiment of feeling gaslit, feeling left out by the system. 95% of respondents said that they had sought assistance for pain, and 71% reported feeling dismissed by healthcare professionals when doing so, when seeking that help. They also identified high costs and wait times as major barriers to accessing care, and a third of respondents reported feeling stressed and frustrated after receiving what they described as insensitive and disrespectful advice. There are some specific examples of respondents' stories throughout the report. One participant said, quote, "I had a doctor tell me I was a drug addict because I asked for stronger pain relief medication." That is a really common experience in the findings. Another person described feeling guilty about clogging up the system, to use her words, because she often presented to hospital emergency rooms with intense and chronic pain and was sent home without diagnosis, without treatment, without support. Respondents described having to visit multiple providers to receive a correct diagnosis. 52% of respondents, so more than half of women, accessed 6 or more different services to help manage their pain, with additional challenges for women in rural Victoria.
That is a lot. 6 different services to try to treat the same condition.
Yeah, so it is the norm that women are seeking multiple perspectives, opinions, appointments just to get to the bottom of their pain.
And health is such a huge part of all of our lives. So I imagine that, if you are having these issues in this area of your life, it's actually also having a flow-on effect with the rest of your life.
Hi, I'm Ola.
And I'm Elliot.
We're the 2-person team behind everything video and audio here at the Daily Aus.
If you want to help us grow so we can deliver more of the content that you love, be sure to hit subscribe.
Now let's get back to the video.
Absolutely. I mean, some respondents have admitted to self-medicating or using unregulated treatment options just to manage their pain, just to get by. So that includes medicinal cannabis. That can include, taking prescription medication that wasn't prescribed to that individual person, and an overall distrust in the system. The report also acknowledged that misdiagnoses and delayed diagnoses cause widespread problems. 53% of women have experienced delayed diagnoses, which means that many of them have suffered unnecessarily for years or even had their conditions worsen because they weren't receiving treatment. More than half said their pain had impacted their intimate relationships. 59% said it impacted their recreation and hobbies. That's more than half of women saying that they haven't showed up to social events or they haven't connected with their friends and family because, on any given day, they can't leave the house or they are so uncomfortable. 44% said it impacted their work, their schooling or volunteer activities. So we really are talking about pain that is impacting every aspect of women's lives, fundamentally changing how they engage with the world around them, and a healthcare system that they say has not taken them seriously.
And I know that government inquiries like this, they always are accompanied with recommendations. What were the recommendations here, either to the government or to the healthcare system?
Yeah, they are far-reaching and widespread. There are 27 recommendations. I won't get into all of them at an individual level, but there are some key themes, some core areas. That includes more focus and funding for women's health research, better education and awareness about pain, including more training for healthcare professionals, expanding school education programs, destigmatizing a lot of the kind of stereotypical attitudes towards women's pain. It recommended creating clearer pathways for treatment so that women don't have to bounce between different specialists, more clear pathways to getting direct answers and assistance. There were recommendations around growing the healthcare workforce, getting more employed and trained professionals to address women's pain conditions, and making support more accessible and affordable. This was a really big one, given how many respondents cited cost as a barrier, especially women in disadvantaged communities, regional and remote communities, and women in LGBTQ communities.
And those are recommendations to the government?
To the government, exactly.
And so then how has the government responded?
So they have announced some immediate measures that they'll start rolling out. There's a pilot rollout to come soon of the green whistle pain relief inhaler for IUD insertion. Now, for anyone who doesn't know what I'm talking about, IUD insertion, so think of something like the Mirena, that can be an extremely painful thing to have to go through. Historically, there has been inadequate pain relief offered, or it's been incredibly expensive to pay for sedation, to pay for either a general anesthetic or what's called twilight sedation. So that pain relief inhaler will become more accessible. The Victorian Government is also establishing a reproductive health and pain clinic for under 18-year-olds. That will be in Melbourne. And that's really significant because young people often struggle to have their pain taken seriously, and addressing women's pain in those earlier years of adolescence can really set women up for better health outcomes and a more positive experience throughout their adulthood.
So that's the response from the government. What about the response from the healthcare industry?
The response has been really widespread and broadly welcoming of these findings of this inquiry in the first place. You know, yes, we are talking about one state. We're talking about Victoria here, but it has certainly created a national conversation, especially considering this is the first inquiry of its kind in the country. So Endometriosis Australia has called for swift action from governments and clinicians and researchers, saying, you know, this is confronting evidence, but it's a powerful catalyst for change. Quote, women deserve timely, compassionate, evidence-based care. The Australian Psychological Society is calling for improved access to psychological care as part of the Victorian Government response. They want that psychological care to be a priority for access. Women's Health Victoria CEO Sally Hasler called the report a really powerful and courageous collection of women's evidence. She is calling for the federal government to increase Medicare coverage for specialist and complex appointments so women aren't unfairly out of pocket. And that is part of that national conversation that has been triggered.
So it sounds like broadly most parties are really in support of this inquiry and hope that it will galvanise the industry and the government to take more action to take women's pain more seriously.
Yeah.
And so then what about the Victorian opposition?
Yes. So we have heard from the Shadow Health Minister, Georgie Crozier. This is Victoria's Liberal opposition. She's acknowledged that the report highlights important issues, but she's criticised the Labor government for underfunding community health. Basically, the opposition says that vital clinics have been forced to close because there's been an underfunding in community health initiatives. And she argued that women with chronic pain are going to be left without support going forward because of the impact that this has had on GPs, nurses, mental health support channels. So a funding criticism there.
Got it. So they're saying they are in support of this inquiry, but they're pointing the finger at the government for letting all of these issues happen in the first place.
Exactly. And suggesting that some of the policy initiatives may not be feasible because of years of underfunding, in their words, basically.
So what are the next steps from here?
Well, over the next 6 months, the Victorian Government has committed to developing an action plan. This will be in response to the findings from the report, and it says that it will do so in consultation with the community, including patients, women with lived experience, healthcare practitioners, you know, the full kind of gamut of stakeholders. We've also heard from Professor Danielle Mazza. She's the head of the Department of General Practice at Monash University. And she commended the Victorian Government for holding the inquiry, saying they, quote, opened Pandora's box and had the courage to seek out and hear what women had to say. Off the back of that, Professor Mazza has shed light on an interesting conversation about GPs. Now, GPs are ultimately the first line of defence for our healthcare system. They are often the first practitioner that women will be in contact with when it comes to addressing their pain. And Professor Mazza has pointed to a need for GP care to evolve as a matter of priority, that training models need a lot more focus on women's health and women's pain needs. And for any of these reforms to really overhaul women's pain, the first stop is GPs. So I think we are going to see an interesting conversation in the weeks and months to come at a national level about that very first step and how we are engaging with health practitioners in the GP consult room and beyond to, specialists and surgeons.
It'll be interesting to also see if any other states or territories follow suit with this kind of inquiry.
Absolutely.
Thank you so much for breaking that down.
Thanks for having me.
And thank you so much for listening to this episode of The Daily Aus. We will be back this afternoon with your evening headlines, but until then, have a great day.